Hello, everyone. My name is Miss Cousin, and I'm going to be your professor this evening on Chapter 36, Patient Interview and History. So how we're going to conduct this class is if you have any questions, I ask that you please type them inside of your chat so that way I can see the question and I will answer any question that you have as we move forward. Even when I ask you questions, just type it in the chat because this is a recording and I don't want to have anyone's voice inside of the actual recording. All right, so let's jump right on into Chapter 36, Patient Interview and History. All right, when we finish this chapter, you should be able to identify the skills that are necessary to conduct a patient interview. You should also be able to recognize different signs from your patients of anxiety, depression, physical, mental, and substance abuse. You should also be able to utilize and understand the 6 C's for writing an accurate patient history and be able to carry out a patient history using your critical thinking skills. All right, let's jump in. So the first thing first is the first step in the examination process, and that is your patient interview. Patients have a standard rights and responsibility that a medical assistant is expected to be familiar with. How many of you have ever heard of HIPAA laws? Okay, well, HIPAA laws enforce privacy and must be posted in a clear and prominent location within your facility where you're working. It is also important that you as a medical assistant demonstrate adherence to these rules and these statutes, but overall you must show professionalism and poise. This also can be a direct result of your verbal communication skills. When you are interviewing a patient, it is an excellent way for you to be able to demonstrate your professionalism inside of that interview. You want to make sure that you are using your effective listening skills by repeating in your own words what the patient has said, because you want to be sure that you understand what the patient is trying to communicate to you as the MA. Another big thing that you want to do is make sure that you are paying attention to a patient's facial expressions and other body language as you are asking a question and as they are actually answering the questions. Any questions? All right. Well, I have a question for you. What is the first step in the examination process? I'll give you a few seconds to type your answers inside of the chat. All right, so most of you who put patient interview inside the chat, you are correct. That is the first step in the exam process, is the patient interview. All right, now let's look at a patient interview in history of the successful interview. Okay, so before starting the patient interview, you want to make sure that you take the time to actually review the medical record, and then you want to develop a plan for asking pertinent questions. You want to make sure that your questions are going to get you the answers that you actually need to be able to help the physician. So you want to ask the patient before you start permission to actually conduct the interview. Okay, you want to make your patient feel like that they're at ease, and you want to conduct the interview most definitely in a private area without any interruptions. Okay, so anytime that you are getting ready to do this interview, you want to make sure that you close the door behind you. All right, because it is your role as the medical assistant, one, to make sure they have a private location to be able to express what is going on with them, and it's also your duty and your role to also observe your patient. Any request for a diagnostic opinion that a patient asks you for, you want to make sure that you always refer that to the physician. You never want to seem as though you are the physician and that you are the one that's trying to diagnose your patient. When you get ready to conclude your interview, you want to conclude your interview in the process by summarizing all the key points, and you want to ask the patient if there are questions or other information that they would like to add. All right, so another question. What word means restate exactly what the patient says? Give you a few seconds to put in the chat what you think it is. Okay? All right. All right. So, those of you who typed mirroring, you are correct. Okay, so let's take a look at some things that you would do in your role as an observer. So you have anxiety. Anxiety is normally a common emotional response to patients. A lot of times they are just anxious because they don't know what to expect from results that they probably got or what's actually going on with them. Now, when we're dealing with depression, depression can be difficult to recognize. So a lot of times the physician is the one that actually has to determine if the person's in a depressed state. And normally how they determine this is usually by patients answering a series of questions that helps them come up with that diagnosis. Now, physical abuse may be detected with telltale signs. And this can be anything from head injuries, skull fractures, burns, broken bones, and bruises. Now, anything dealing with psychological abuse is very hard for you to be able to determine as a medical assistant. This mainly falls on the physician, where they have to actually pay more attention to it because this can be a little bit more subtle. Now, when you are interviewing patients for abuse, and in most cases is women, children, and the elderly. When we talk about women, children, and elderly, they are more likely to be abused. Statistically, women between the ages of 20 and 24 are at the greatest risk of being abused, and they tend to stay in these abusive relationships for a variety of reasons. Now, abuse of a child can be physical, it can also be emotional or sexual, but there can also be some neglect involved inside of this abuse. So it's very important for you as a medical assistant to pay careful attention to the relationship between the child and the caregiver. Now, when it comes to the elderly, they are often dependent upon their caregiver or unable to communicate to report any type of abuse that is taking place. So it's very important for you to observe elderly patients for their nonverbal signs of their problems. Now, if you happen to suspect any type of abuse, neglect, or exploitation, it's important for you as a healthcare professional to report this. But when you do report this, you want to make sure that you follow your local and state reporting guidelines if you suspect any of these. Now, substance abuse. Substance abuse may be can cause a person to behave erratically. The abuse of alcohol may have no signs or symptoms at the onset, but as time goes on, the person may suffer from blackouts or become secretive and guilty. The healthcare team members who recognize a problem should try to persuade a patient who is going through something of some type of abuse, such as alcohol or drugs or whatnot. You want to make sure that you persuade them to seek help. Now, somebody asked me, well, Ms. Cousin, what is the difference between substance abuse and addiction? Well, substance abuse refers to the use of a substance in a way that is not medically prescribed or medically approved. Addiction refers to a physical or psychological dependence on a substance. All right, so let's take a look at documenting the patient information, the use of the 6 C's, okay? Now, when we take and place quotations around a client's words, what we are doing is we're recording exactly what the patient has said for the physician. All right. Now, we also will use medical terminology. So medical terminology and precise descriptions is used to make sure that we have clarity. Now, when it comes to patient forms, we want to make sure that they are completely filled out inside of your patient record. We also want to make sure that we save time and space by being concise when recording our information. All the dates that we have placed on a patient record, any type of entries on the patient record, are critical in the documentation of care provided. Most charts are arranged in chronological order with the most recent information on top. Most of the time you will notice this if you happen to be in an office that deals with paper charting. And if they have paper charting, most of the time you will see it is more recognizable that way, because you will actually see that the last visit is actually sitting on top and the very first visit is on the bottom. Okay. Now, also, we talked about this a little earlier, is confidentiality. It's very important that you protect a patient's privacy. So anything that the patient talks about or anything that goes on in that room is supposed to be kept private at all times. All right, so question. Why do we put quotations around the patient's words or client's words? I'll give you a few seconds to put your answers in the chat. Okay, so for some of you, you have put to record exactly what was said for the physician. That is absolutely correct. All right, moving on. All right, this here is just a list of what is contained inside of each patient's chart. So each patient's chart will contain standard information in set categories. You have the registration form and medical history tab. That's exactly what goes in there. Those are the papers that are filled out when the patient first comes into the physician's office for the very first time. You also have a section for test results and records of all providers. This is actually from if the doctor send them off to have any type of test done, blood work, or different things like that. All that goes underneath there. Diagnosis and treatment plan, that is what the doctor has decided to do to treat the patient and what their diagnosis is. All that goes under this section. Operative reports is basically if a patient happens to go into the facility or hospital and had to have some type of surgery, the operative report would come from that, and you would place that in this section. Informed consent forms all go in this section. Is just where we have forms that proves that a patient gave us permission, where they have signed saying that we can actually conduct the procedure that has taken place. Discharge summary. This is also from when a patient has actually been in the hospital, has surgery, and these are the paperwork that comes after. And not all the times is it necessarily where the patient has surgery. They could have went to the hospital and had an issue going on, and the doctor provided them with instructions of what they need to do after they are left or been dismissed from the hospital. And then correspondences, of course, are any type of emails or phone call messages that has come from your patient. It goes actually in this tab as well. All right, moving right along. Are there any questions so far? I've only had the 1 or 2 questions and we answered those, but are there any other questions that anybody needs clarity on for what we talked about so far? If you do, just place it in the chat and I will stop and answer your question. Okay, so now let's talk about the different methods of charting that we have. We have source-oriented medical records, which is abbreviated SOMR. The SOMR information is arranged according to who supplied the data, whether it was the patient, whether it was from the results or from someone else. That's how it's actually arranged inside the patient's chart. Now, POMAR is problem-oriented medical records, and this revolves around the problem list. There is a database of the patient's medical history, diagnostic and lab results, along with physical examination reports to serve as the basis of the organizing of the POMAR. Now, each patient's condition or problem is listed individually and is assigned a number and a date. Now, lab and other diagnostic tests are done, and the provider's treatment plan for the condition is also documented. Now, you also have what they call a progress note, which some of you will see later on, where we actually do those in other chapter, where we do with the progress notes, where they are entered chronological to include the chief complaint, the problem, the condition, the treatment, and the response to the treatment. Now, we also have computerized records. Remember, I was talking about the paper charts, but we have also computerized records, and most physicians' offices are now going to computerized records. Now, in the use of the computerized records, most of the time they use a combination of both the SOMAR, which is source-oriented medical records, and the POMAR, which is problem-oriented medical records. Now, also you see SOAP, and SOAP stands for subjective data, which is the patient's own words. Then you have objective data, which is the test results and the doctor's examination. And then you have assessment, which is the diagnosis or the impression. And last but not least, you have plan of action. The plan of action is which is what is going to be the treatment, what is going to be the medication, or what is the test plan. Now, when it comes to abbreviations, we can only use abbreviations in a patient's chart that has been approved by the facility as well as the Joint Commission. All right. All right, here's a quick question. What is the acronym for subjective, objective, assessment, and plan of action? Please type your response in the chat. All right. Thank you. Very good. SOAP, S-O-A-P. That is the acronym. Very good. Okay, so let's take a look at another acronym, which is PQRST. These all have their own meaning behind them. So as we look at the letter P, P stands for provoking factors or palliative. So those will be some questions that you want to ask with dealing with the patient's symptoms and talking about when it actually started. Palliative kind of deals with how the person feels. Now, Q stands for quality, which talks about like what does the pain feel like? Burning, is it sharp? Then the quantity is talking about time or how often things happen. R is dealing with radiation or region, like where is the pain located? And then S stands for severity, like how bad is it? And then timing stands for, T stands for timing, which is timing and triggers. Letting you know when it actually came on. Oh, someone asked, can I give an example question for each of these? Sure. Okay, so P, for provoking, you could say, what brought on the symptom, or what were you doing when it started? Then palliative is, what makes it better? That would be a good question you could ask. For quality, you could say, is the pain stabbing? Is it burning? Is it sharp? Is it a gnawing feeling? And then quantity, how often or how many times does it happen? The radiation, does the pain go anywhere or does it stay in one region? S, severity or symptoms, how bad is it? Are there any other symptoms associated with it? T, timing and triggers. When did it come on? Is it continuous or intermittent? What makes it worse or what makes it better? Those are some questions that you can ask to help you chart and get an answer as to what's going on with your patient. Now, the progress note, which I talked about a little bit earlier, may also follow the SOAP format, and it will be dated and arranged in reverse chronological order in this format as well. And each entry should be initialed and signed. So every time you put an entry in there, you want to make sure that you sign and initial the progress note or the note that you have put into the patient's chart. Now, many patients take a large amount of medication with multiple kinds for the same condition. This is what we call polypharmacy. So the polypharmacy needs to be carefully documented, and you must follow up on these medications as well, making sure that they are actually still taking all the medications and the dosages. All right, let's take a look at health history form. And I just shut my camera off for this slide just because my camera was covering up some of the words. But on your health history form, the health history form stores personal data in the heading. It has the chief complaint, which is recorded along with the history of the patient's illness, and given their further details. Past medical history. This will list all health problems, present and past. This also includes major illnesses and surgery. Your family history is gathered to assist the practitioner with complete knowledge of the current medical problem. Then you have social and occupational history. This is sought to help to determine a patient's risk for diseases. Some of these components may be a little sensitive subjects for patients, so you may want to take a gentle approach when you are interviewing your patient on these certain questions here. The review of systems, this is started by the patient and completed by the practitioner. A systemic review of each of the body systems includes questions and systemic exam by the practitioner. Okay, question. Which part of the health history form is gathered to assist the practitioner with complete knowledge of the current medical problem? Go ahead, type your answer in the chat. All right, getting a lot of answers here. Okay, the answer is family history. Okay. All right, I would like to take this time to thank you for paying attention to my lecture here. This is your summary. You should now be able to provide feedback on patient interview skills, recognize signs, understand the 6 C's of writing accurate patient history, and be able to utilize your critical thinking skills in all aspects of the patient interview. I look forward to seeing you guys next time. Have a great day.